Welcome to today's deep dive.
Yeah, we're going deep into the world of SIBO,
Yeah.
which stands for Small Intestinal Bacterial Overgrowth.
All right.
And we've got a transcript here from a medical professional.
Okay.
Um, and we're going to use that to kind of guide us through this really fascinating topic.
Yeah.
You know, you hear so much about gut health these days,
Mm-hmm.
and rightfully so, but SIBO kind of takes that a step further,
Right.
looking at a specific kind of imbalance in your gut bacteria. And that's what we really want to unpack today. We want to kind of give you clear information about SIBO, address some of those common misconceptions,
Yeah.
and just equip you to better understand this condition and its implications and really how it could be connected to maybe some health issues that you're dealing with that you might not even realize are related.
It's a topic that needs some clarity for sure.
Hmm.
Especially because there is some controversy
Right.
surrounding SIBO within the medical community.
Oh, really?
Yeah, some practitioners even dismiss it
Why?
as non-existent or a fad. So right away, we're diving right into the deep end of the debate.
Yeah.
What's fueling this kind of skepticism?
Well, the source highlights a few key points.
Mm-hmm.
One example is the experience of a patient who was told by her doctor that SIBO wasn't real and that her symptoms were simply
Oh.
due to IBS or irritable bowel syndrome.
Okay.
So it seems like there's a tendency to oversimplify the diagnosis,
Yeah.
attributing a range of digestive symptoms to IBS without considering other possibilities,
Yeah.
like SIBO.
That's really concerning, especially when you consider that SIBO has been studied for over a century.
Exactly.
It's not some brand new concept.
It's not a new fad at all. The source points out that SIBO was first described over 100 years ago
Wow.
and potentially recognized even earlier in medical literature from the mid-19th century.
That's incredible.
What's fascinating is that the early understanding of SIBO was linked to conditions that cause physical obstructions in the small intestine, leading to bacterial overgrowth.
Mhm.
So this historical context helps us understand
Brr.
how the concept of SIBO has evolved over time.
Yeah.
And it highlights the need for continued research
Mhm.
to fully grasp its complexities.
So if SIBO is not a new fad, let's break down what's actually happening in the gut. What does bacterial overgrowth really mean?
Okay, so think of your gut as a bustling city with different neighborhoods.
Okay.
The large intestine is like the main hub
Yeah.
with a diverse population of bacteria,
Mhm.
which is a normal and healthy part of digestion.
Okay.
But the small intestine is more like a quieter
Yeah.
residential area
Mm.
with a different mix of bacteria
Yeah.
and lower overall population. In SIBO, it's as if some of those city dwellers from the large intestine decided to move into the quieter neighborhood,
Mm.
disrupting the balance
Yeah.
and causing a ruckus.
So how does this ruckus translate into the actual symptoms people experience?
These bacteria now in the wrong neighborhood
Mm.
start fermenting certain types of fiber in the small intestine. This fermentation process produces excessive amounts of gas,
Oh.
including hydrogen methane and hydrogen sulfide. Remember that rotten egg smell?
Yeah.
That's hydrogen sulfide at work. This excess gas is a major contributor to the bloating, which the source vividly describes as feeling like a 7-month pregnancy.
Wow. That's definitely not the kind of gut feeling you want. But it
But-
sounds like the symptoms go beyond just bloating and discomfort.
Absolutely. The source also describes other common digestive issues, like diarrhea, constipation,
Yeah.
or even a frustrating alternation between the two.
Oh, God.
And then there's the pain, which is often triggered by eating certain foods.
Okay, what kind of foods are we talking about?
Think legumes, onions, garlic, wheat, fermented foods.
Yeah.
Those are all things those bacteria love to feast on.
So identifying those trigger foods could be really helpful for managing symptoms. Is that something that the source addresses?
While dietary modifications can play a role in managing SIBO, the source emphasizes that it's not a simple fix. It's about understanding the underlying causes of the overgrowth and addressing them, rather than just masking the symptoms with diet alone.
That makes sense. But it also sounds like the impact of SIBO goes beyond just gut symptoms.
You're right. The source mentions a range of symptoms beyond the gut, including brain fog, joint pain, skin problems, and even allergies.
It's kind of surprising, but it makes sense when you think about how interconnected all of our systems are.
Exactly. The source uses the phrase spaced out to describe the feeling of brain fog associated with SIBO, highlighting the impact it can have on cognitive function
Yeah.
and mental clarity.
Yeah.
They also discuss how SIBO can worsen skin conditions,
Mm.
potentially contributing to inflammation and breakouts. These far-reaching effects really highlight how SIBO is not just a digestive issue,
Mm.
but a condition that can affect various aspects of well-being.
And this is where the source delves into what really captured my attention, the link between SIBO and other health conditions.
Right.
They describe it as a bidirectional relationship. Can you elaborate on what that means?
Imagine a two-way street. SIBO can contribute to the development or worsening of other conditions,
Okay.
while those same conditions can in turn make SIBO more likely or harder to treat. It's a complex interplay that researchers are still trying to fully understand.
So it's not just about treating SIBO in isolation, but also considering the bigger picture of a person's overall health and any other underlying conditions they might have.
Yeah.
What are some specific examples of conditions linked to SIBO? The source specifically mentions diabetes, thyroid diseases like Hashimoto's thyroiditis, and autoimmune diseases like systemic sclerosis.
Okay.
What's the connection there?
Well, in the case of diabetes, research suggests that SIBO might impair blood sugar control and increase insulin resistance.
Mm-hmm.
This connection could be due to changes in the gut microbiome, influencing how the body processes glucose.
And what about autoimmune conditions?
That's where things get really interesting.
Yeah.
SIBO can trigger inflammation in the gut, and that inflammation doesn't necessarily stay put. It can spread throughout the body, potentially contributing to the development or worsening of autoimmune conditions, where the immune system mistakenly attacks healthy tissues.
So addressing SIBO could be a crucial part of managing these conditions and improving overall well-being.
Precisely. Treating SIBO might not just alleviate those troublesome gut symptoms, but it could also have a ripple effect, improving symptoms and quality of life for individuals with these interconnected health issues.
That's a powerful concept. It highlights how seemingly isolated symptoms might actually be linked to a deeper underlying issue in the gut.
It's like solving a mystery, isn't it? Connecting the dots and finding the root cause.
Yeah.
And this brings us to a point that the source touches on, the recent surge in awareness about SIBO.
It does seem like gut health is having a moment in the spotlight. What are your thoughts on that?
It's a mixed bag, really.
Mm.
On one hand, heightened awareness is fantastic. It encourages people to pay attention to their gut health
Mm-hmm.
and seek help if they're experiencing issues.
Mm-hmm.
It also opens up conversations that might have been considered taboo in the past.
But there's a potential downside as well, right?
Yes, there's a risk of oversimplification. The source mentions an example of an influencer who struggled with SIBO for 2 years, relying solely on restrictive dieting without experiencing any significant improvement.
It sounds like they were missing a crucial piece of the puzzle.
Exactly. Treating SIBO effectively requires a personalized approach that goes beyond just diet.
Okay.
The source stresses the importance of identifying the root cause of the overgrowth. Why are these bacteria thriving in the small intestine in the first place? Is it a motility issue, a problem with stomach acid production, or something else entirely?
So it's not a one-size-fits-all solution. It seems like getting to the bottom of SIBO requires a deeper level of investigation.
Absolutely. The source advocates for a comprehensive approach that involves working with a qualified healthcare professional to determine the best testing methods and develop a targeted treatment plan.
What kind of testing is typically involved?
Breath testing is often used to diagnose SIBO. This test measures the gases produced by the bacteria in your small intestine, helping to identify if there's an overgrowth and what types of gas are being produced. This information can guide treatment decisions, as different types of bacteria might require different approaches.
It seems like understanding the nuances of SIBO, like the different types of bacteria involved, is crucial for effective treatment.
You're right. The source mentions that some bacteria produce primarily hydrogen gas, while others produce methane or hydrogen sulfide. Each type of gas can contribute to different symptoms and may require a different approach to treatment.
That makes sense. So what are the typical treatment options for SIBO once the underlying cause has been identified?
The source highlights the importance of a multifaceted approach that often involves a combination of strategies.
Okay.
Antibiotics are sometimes prescribed to target the overgrowth of bacteria, but it's not as simple as just taking a course of antibiotics and calling it a day.
It sounds like a more holistic approach is necessary. Yeah.
Exactly. Addressing dietary factors is often a key component of treatment. This might involve identifying and eliminating trigger foods, as well as incorporating foods that support gut health and help restore a healthy balance of bacteria.
So it's not just about what you eliminate from your diet, but also what you add.
Precisely. Probiotics, for example, can be helpful in repopulating the gut with beneficial bacteria.
Okay.
Prebiotics, on the other hand, act as food for the good bacteria, helping them to thrive.
So it's about creating an environment that supports a healthy gut ecosystem?
Exactly. The source also mentions the potential role of prokinetics, medications that help to improve gut motility, or the movement of food through the digestive tract.
That's interesting. So improving how the gut functions mechanically can also contribute to resolving SIBO.
Exactly. It's all about addressing those underlying factors
Mm-hmm.
that are contributing to the bacterial overgrowth.
What about alternative therapies? Does the source touch on those?
The source focuses primarily on conventional medical approaches, but it's worth noting that there's increasing interest in complementary therapies for SIBO, such as herbal remedies and acupuncture. However, it's essential to approach these therapies with caution and consult with a qualified healthcare professional to ensure they're safe and appropriate for your individual needs.
That's a crucial point. It seems like navigating the world of SIBO requires a balanced approach, combining conventional medicine with a willingness to explore alternative options, but always under the guidance of a knowledgeable healthcare professional.
Absolutely. It's about finding the right combination of therapies that address your unique needs and help you achieve lasting relief.
So what does all this mean for our listener? What are the key takeaways they should keep in mind as they continue their own exploration of gut health?
Firstly, remember that SIBO is a real and treatable condition, despite any skepticism you might encounter. Don't dismiss your symptoms or let anyone tell you it's all in your head.
And it's not just about digestive discomfort, right? The impact of SIBO can extend far beyond the gut, affecting various aspects of your health and well-being.
Exactly. Pay attention to those seemingly unrelated symptoms, as they might be connected to your gut health.
And if you suspect you might have SIBO, don't rely on Dr. Google or self-diagnosis. Seek guidance from a qualified healthcare professional who can help you get a proper diagnosis and develop a personalized treatment plan.
Remember, you are your own best advocate for your health. Don't be afraid to ask questions. Seek second opinions if needed, and push for answers until you feel heard and understood.
It's about finding a healthcare provider who will partner with you on your journey to better gut health.
And that brings us to an important question for our listener to ponder. What are your next steps?
What questions do you still have about SIBO and how it might be impacting your own health?
Yeah, have you experienced any of the symptoms we've talked about today? Even those that might seem unrelated to your gut?
And what resources are out there? What tools might you explore to kind of delve deeper into understanding your own gut health journey?
You know, this deep dive has given you a solid foundation of knowledge about SIBO, but it's just the beginning of your own exploration.
Knowledge is power,
Yeah.
especially when it comes to your health.
Absolutely.
So keep learning, keep asking questions, and keep advocating for your own well-being.
And most importantly, take care of that incredible gut of yours. It's a complex and fascinating ecosystem that plays a vital role in your overall health.
Thanks for joining us on this deep dive into the world of SIBO. We hope you found it insightful and empowering.